And we are live. Hello, everyone, and welcome to another episode of Translators on Air. My name is Dmitry Kornyukhov. I'm your host. Join me today, my incredible co-host, Elena Tereshenkova. Hi, Elena.
Hi, everyone.
And our guest today, Pablo Mugüerza. Hi, Pablo.
Hi, Dmitry. Hi, Elena.
Hello.
Thank you so much for joining us today. We are very excited to have you on our show. Pablo is a Spanish medical translator with almost 30 years of translating experience, both on-site and as a freelance translator. He received his medical degree in 1987, and since then he has worked for the most important translation agencies in Spain and abroad, and for most major pharmaceutical companies and contract research organizations. And in today's webinar, we're going to talk about why you might want to become a medical translator, what skills you need, and how you can acquire them, and most importantly, where you can find more work as a medical translator. But before we jump to the topic of our conversation, I would like to make a few announcements. As always, the third season of Translators on Air has been sponsored by our friends at SmartCat. SmartCat offers an awesome translation community and a platform where you can find more translation jobs, and you can also use their CAT tool absolutely for free. So if this is something you're interested in, check out SmartCat by clicking the green button below this video, or if you're watching or listening this in a recording, just visit the first link in the description. All right, we have quite a few people joining us today. Hello, Anike, Biljana, Andrei, Susanna, Kazuki, Marina, Jenny, Roberta, Victoria, Eve, Maria, Nathalie, Maria, Judy, Nicholas, Romina, Carlos, Angelique, Maria again, Carolina, Monica, Christina, Marcela, Yanina, Denise, Natalia, Cecilia, Elena, Roberta, Ines. Thank you so much for tuning in. I hope I haven't butchered any of your names. If I have, I apologize for that. It seems like we have a lot of Marinas. Thank you so much for tuning in for this webinar. I can see that we have quite a few new faces who hasn't been on our previous webinar. So let me just show you how this platform works. This is the live webinar. Everything is happening in real time. You can actually participate in the discussion by using the chat window on the right-hand side. You can say hi, where you're from, what languages you work with, etc. And if you have a specific question that you want Pablo, Yelena, and me to discuss, you can both ask your question or make a suggestion by clicking an orange button below this video that says ask a question or suggest a topic, or you can upvote the questions that are very interesting for you, because we already have quite a few questions and we will be more than happy to discuss them. And of course, these webinars are best enjoyed with friends and colleagues. We have a few spots left, so if you can, please share a link to this webinar on social media right now, like on Twitter or Facebook. You can use our hashtag Translators on Air and invite your friends and colleagues to join us, because we're going to have a very interesting conversation today with Pablo. All right, Pablo, how are you?
I'm fine, thank you. How are you?
Good, good. How's your day going?
I'm very well. I've had a very great day today, and I'm really excited to be here. By the way, I would like to use this opportunity to say thank you to Elena and to Dmitry for their invitation to participate here, and to our sponsor, Crowdcast. To me, it's a very big honor to be here today. I'm very grateful, and I hope all the attendees will find interesting what I will say, what we will comment on this conversation, and I'm sure that they will get useful tips and a few of advices for those things everyone wants to know: how to get more work, how to fight in the networks, and I hope I will get all that.
Yeah, awesome. Pablo, can you please tell us a little bit about yourself, and can you please share how you got into medical translation and why exactly into medical translation? Can you please tell us a little bit about your journey in this awesome profession?
Yes, about me. I studied medicine, and while I was studying, this is 3 years ago, while I was studying, I was translating from McGraw-Hill, which is a large publishing house, you probably know, and I was translating, you know, as a beginner, but it was, I really loved that, and I could get some money, and I was working at my home while studying. So when I finished medicine, I went to the army. You know, at that time it was compulsory in Spain. Spain to go to spend some time at the army. And while I spent 1 year there, working as a doctor, as a certificate doctor, and I had a lot of spare time. And in the meantime, I had to decide if either going on medical or maybe switching to translation. And I did that. When I finished the army, McGraw-Hill offered me a very good contract, very good conditions as a in-house translator in their medical department. At that time, there was a medical translation department for English into Spanish for Spain and all Latin America. So it was really a great opportunity. And I didn't think, I just left, quit medicine, practicing medicine, although that's something you never quit because you're always a doctor and you always have neighbors and family and everybody asking you before they go to the doctor, you know, and trying to avoid that. They say, by the way, what do you think about this drug or about this therapy? And I started translating. It was great. It was a few years at McGraw, and after 5 or 6 years, I started as freelance. And since then, I have had many opportunities to work for many clients all over the world. And well, that's a summary of my experience.
Awesome.
So would you say that it's compulsory to be a doctor, a medical doctor, in order to translate medicine?
No. Sorry, can you repeat that?
Do you think it's necessary to be a doctor to translate medical texts?
Of course not. Of course not. You don't need to be a doctor to be. It's very helpful, extremely helpful. I teach regularly on the internet and on other media, and I have students. And the best students who are not doctors, when they face something like, let's say, an acute lymphoblastic leukemia of B-cell precursors, it takes them really a lot of time just to get it translated. They don't learn what a leukemia is, what an acute leukemia is different from a chronic one, what a lymphoblastic or myeloblastic or myelogenic leukemia is, what B cells are. They can translate that well, but they don't know what we're talking about. My question, after when they have made the exercise and they reach the right terms, is, okay, your translation is okay, but do you know what a leukemia is? And they don't. They have been researching and investigating, and it's very difficult to find what the types of leukemias. This is an example when you are not, because that means a background, years of study. And of course, to me, it's easier, but you don't need to be a doctor. I've met in these 30 years wonderful, the best translators. They were not doctors. They were very good translators, and they were highly specialized in medicine, and particularly in clinical trials, which is my ultra specialization. And but you don't need to be a doctor.
But if you work in the medical field, do you think it is important to pick a certain, like you said, ultra specialization, like a certain field of medicine, or you can just be a general medical translator?
My opinion, of course, there are other opinions, but my opinion is that the more you specialize, the better. Of course, that bounding your experience, your working field, bounding to medicine is on a specialization, and you're leaving apart a lot of like law, translation, or technical. You're leaving that apart. So you specialize into medicine. Once you're there into medicine, my opinion is that you can also specialize. For instance, in the last, say, 5 years, I would say that 80 or 90% of the texts I've translated were about oncology, immunology, immuno-oncology, genetics, and so with the time, I have specialized, also specialized in that, and it translates into more clients. They are looking for me because I've been talking in conferences or in the internet. I've been showing that I am very good at that. I know what I'm talking about, and you won't find easily someone who is able to talk about genetics and its translation. So I would recommend people, so particularly those who are thinking, well, I like medical and I'm doing some medical, but I do all kinds of medical translation. I would recommend them to also specialize and get hematology, I don't know, pediatrics, those specialties which are really leading the market. And as I told you, the 80% of my job in the last 5 years. And it seems that today and in the next 10 or 20 years, it will be the leading topic, the leading issue. So it's a chance. It's difficult. It's extremely difficult, I have to say, at least for me. Probably those translators who are more intelligent than I am will find it easier. But to me, it's difficult, I have to say. But it's very rewarding. You are in the mood. That's what's happening. If you are in the networks, what you will see all the time is people, the discoveries, the Nobel Prize, wherever it's about genetics and immunology. So I would recommend that.
That makes perfect sense. There are a lot of translators watching us right now who are just starting out and they like medicine and they probably want to break into this field, but like with everything in life, it's quite challenging and there are a lot of challenges along the way. So what do you think are the most common challenges for someone who would like to pursue medicine as one of their specializations, and how can they overcome those challenges?
I'm not really sure about, because most of my students are already working, and I'm not very sure about, but I guess that the challenges, first of all, are how to get this medical background. Because once you have studied, at least in Spain, once you have get your degree in translation and interpretation, you know far more theory of language than you need for this particular field of translation. So you know linguistic enough, you know your language enough, and you know English enough. In my case, if you're translated from English into Spanish, now it's time to study medicine. And you don't need to study medicine as a career, but you get just by reading texts, as they always say, by reading good medical texts, you really can get some training, some very good training. Last year there was one of these, the United Nations, they periodically they have these exams to get new people working for them as translators and interpreters, and they had how do you say, they were on Twitter and people was asking all the time, will you please tell us what we need to study for this exam to become a member of the United Nations? And the community manager of the United Nations always answered, what you have to do is to read good Spanish. I don't have a book to tell you, study this or study here. Read good Spanish. I would say the same. Read good medical translations and read and probably compare with the English if possible. That's what I do with my students always. They always have a lot of exercises where they have the original and the good translation commented by me, and I think they find it extremely useful. So the main challenge is to get the medical background, and there are, of course, a myriad of sources and places on the internet. Just look for it. But what they need to do is to look for a medical teaching, wherever, a medical education from someone involved in translation, from someone who is translating currently as a job. So they are medical physicians like me who are also translators, and you have to look for them. You don't need a translator who likes medicine or who once in a time made some translation, is not translating today, is not aware of what is happening in the market. We will probably talk about how the market is changing, but the topics, the issues. You have to be learning every day. Every day is changing. And today you need, for instance, you need someone who's very keen on CRISPR. I don't know if you've heard about CRISPR, which is a genomic editing technique, which is going to change the world. Probably Nobel Prize next year or in 2 years will be for someone involved with the CRISPR. What you need is someone who has been there and has taken a decision about the translation of CRISPR, which means knowing very well what it is, being probably involved with science, and knows what he's doing because of his experience. So look for teachers, look for places to, sites to learn, where people involved both in medicine and translation currently are working, and those are the ones you need. That's my opinion, my advice to overcome the challenges.
You have partially answered our next question about advice we can give to someone looking for medical translation training. Is there anything else that people who would like to get some kind of training in medical translation should know?
You know what? I'm not very good at languages, only English and Spanish. But so I only translate from English into Spanish. And what happens in this particular area is that we don't have a terminology problem. Incredibly, we have a dictionary. We have there is a platform for translation from English into Spanish. It's called Cosnautas in Spanish, and the author of that, Fernando Navarro, which is a world-renowned authority in our field, has settled every single problem with terminology. So whenever we don't have a terminology problem, so you don't need studying terminology or studying, you don't need that. That is solved. There is an absolute agreement among all of us who work on translation of about the authority of this person, of the particular physician. He's a physician, also became converted into a translator, and so you don't need that. You have to pay for the moment. It's a platform you have to pay to consult, but I think it's worth it's and you have it there. So we don't have a terminology problem. Can you imagine that? When you have everything you can think about, all the problems you may find, not only with medical terminology. The greatest thing about this platform I'm talking about is that you find there, of course, leukemia, but you find also the translation of, let's say, Western world, which is an expression you use in English for Western world, and we translate into something like rich countries. That's what we say in Spanish, approximately, because there's not a Western world. What is the limit between the Western and the Eastern world? So you find that in this book, in this dictionary, not only leukemia and all the possibilities you can find. So that is solved. So what else do you need about reading medical and getting? If you can find it, what you need is some medicine for translators, which you can find. There sources where you can find it. I'm sorry because the Rhine is killing me. You can find the sources where they teach medicine for translators. Of course, I have video courses for ECPD. They are there. They are a little bit old. They need to be renewed. But look for that. Medicine for translators. They're only the medicine you need to know to translate. If you want to translate CRISPR, as I said before, you need to know a few things. You don't need to know everything about genetics, but you have to know a little bit, and you can find that.
Apart from online courses, maybe you could recommend some sort of a online literature for translators or textbooks, or maybe something else.
Beg your pardon?
Apart from online courses, could you recommend maybe some kind of literature or maybe books on medical translation?
I'm not very sure. Not currently, because most books translated into Spanish are. I did translate that. Many years ago, I was in that market, and I know how it is translated. And they don't use the best sources and the best translators. They pay they don't pay well, so they have a lot of work, but huge books. I have a few here that. But of course. The best medicine book you can check always. For me, every doctor has his opinion, but for me, it's a Harrison. I don't know if you know it. Pablo. Excuse me. I will show it to you. Pablo. No, it's here, but if I stand, no. No. Best book, the best medicine book, the one I would really recommend you get a Harrison. You can find summaries on parts of it and the net on the internet. It's easy to access. Of course, there's a paid option, and it's the best medicine book for me from my point of view. It's you have it in textbook, and you have it online also, but they are not very good. I wouldn't recommend any particular about that one particular textbook, because I don't know. I don't know if there are. You don't need them. On the other hand, just to read, but there's enough on the net, on the internet.
Yeah, I see. When you work with medical texts, it requires certain skills. What skills do you think translators need to develop in order to be professional medical translators?
Well, today, it used to be different, right? There was a time when there was you could translate anatomy, or you could translate, I don't know, say biochemistry inside medical translation. But today, what you need is to learn, of course, as I told you, genetics, immunology, immuno-oncology, oncology, but also you have to be pay a lot of attention to what is happening in the clinical trials world, which is investigation, research, medical research, that is leading also the translation. We are translating all the time about medical research. So that's one skill, right? You have to be very well connected and know what is needed in the market. But as well, you have to learn to use CAA CAT tools, of course. You need always, most clients today are using translation memories, and they want you to be good on a few programs. I'm not very good on any one, but I have to use them all the time because, I'm 55 years old, so computers and all that came a little bit late for me. That as a matter of fact, the reason why I left McGraw-Hill many years ago, it was because we had to make a dictionary, the Dorland, which is a very, very famous medical dictionary, very good, by the way, the Dorland dictionary, and we had to make that into Spanish. And I said, I will only do it with computers. And they say, okay, here's the door, goodbye. We are not buying computers for your dictionary. And that was one of the reasons. So you have to be very good at CAT tools, particularly titles, of course, but SDL titles. But most clients will require that. But you have to particularly pay attention. Pay attention to, if you're in the nets, if you're on Twitter and on Facebook, which are the ones I am, and you are joined or following people who's interested in medical translation, you have to pay attention to be on the nets and see what's going on. And all the time you will find a lot of stimuli on new techniques, new skills, where to learn how to bake, I don't know, good presentations in case you need that, but where looking for sources, which sites do you need? Because as you know, if information is widely spread in the internet, and there are fake news of a lot of information which is not worth. There's very good information also. You have to learn to look for that, and it takes a little time, months probably, but if you insist on following the right people on the nets, that's a skill too. Following the right people and see what is going on in the market, on the translation market, you will get it will be easier for you to find clients.
Speaking about translation market, medical translation market, and finding clients, how can you get work as a medical translator?
That's the most popular question.
The most popular question.
I'm quite used because I answer to that question a few times a day. And what can you do? What can you do? It's difficult to say, but it's very basic on one side. The basic for finding work as a translator, a good curriculum, a very good curriculum. It's just to be, and I don't mean just that you elaborated a lot. It has to be perfect. Your curriculum has to be absolutely perfect. We have very little time to have a look on curriculums. We just decide on the first impression. I usually have to decide on what to do with curriculum, right? And you need a very good curriculum, and you have to write to many clients. You have to forget the fear of agencies. Agencies are our friends. They're not our enemies. They're bad agencies and good agencies. There are many good agencies, translator agencies, and they are doing very good. And I've worked with direct clients, and I've worked with agencies, and I do prefer agencies when they are good and they look after me and they prepare the work in a proper way and they give me the right instructions and they know exactly what I do well and they insist on that. They are very good. So get a good curriculum. Look for agencies. Very important. Get connected. Get on Twitter, get on Facebook. I don't know of other, get on LinkedIn, of course. For beginners, it seems very useful. I don't know a word about this, but whenever this issue comes out on the nets or wherever, on forums, they will, there's a lot of people who is using prods. This website props and the Translators Cafe, and say that's good for beginners. Today or yesterday, I read about one called My Translation, another website where they say publicly, so I can say that they pay 5 cents of euro per word, which is low, but for a beginner, you may consider that. I don't know. I don't, each one has, of course, it's very low for me. I cannot accept that. But I always looking for new clients and for what to tell to people who ask me about, when they ask me about getting job. I think it's a possibility to begin, but so get a good curriculum. Try agencies. Try the good ones. They are rated in pros. You can freely access to what's the rate, how they have worked with clients, if they have good experience and good remarks. So get to know them. Try there. You're always looking for good translators and do tests and be very patient. It always comes. At the end, there's always work for you, but it takes months and maybe years, and you don't have the time and you need money. I know that, but it's the only one I can advise. Get a good curriculum, send it when requested to agencies, do tests, get connected, follow the interesting people on Twitter, and very important, this is very important, be a member of an association, of a translator association, the one you like. There are very good ones. Find a good one, because there are bad ones, right? We here in Spain have all kinds, but there are good ones and bad ones. In research and investigate, see what they offer to you, see how much they cost, and decide what. I'm sorry again with my rhinitis, and decide what you need, what they need. But it's very important to be a member of one of these one, because what these societies do is they organize congresses, right? You have to go to the congresses. You have to go to the meetings. Most of my, I have two main clients today. They are Americans. And both of them were a person who were on one of my conferences and who came at the end of the conference, came up to me and said, I'm interested in you. And today they are my best clients. And of course, you're not in my position. I was as a speaker, but I am aware that you get very good relations, that you meet a lot of people who is looking for other translators, and what you will learn from people who's in my position right now is that most of our work comes from colleagues, from friends, people they met at congresses of translators meetings, and with the years, that's not an immediate thing usually. Today, a friend of mine asked me yesterday, for a translation into English of a medical report. I do not translate into English, but I called someone who I have never met, but I am aware because of his presence on the networks and how he talks. We are both members of IDI, the British Association of Translators, and I've seen him, and I know he's good. And he doesn't know, but he was in my head. So when I needed a translator, I called him. and he's working for this other client at a very good rate with a very interesting job and opening his market. So I repeat, a good curriculum, try agencies are our friends, networks, that's very important. Get connected, be there, follow me, follow Dimitri, follow Elena. They are very very good at their and the nets. They're all the time on Twitter and there's a question there, and the, Twitter and on Facebook, and be a member of an association and go to congresses. That's an investment. You need to invest. This is all money. You wouldn't believe that we had this meeting, this translator meeting, and last May in Hungary. Meeting translation, yes, it was wonderful. People learned a lot. We gathered there are like 200 people. Our presentations were superb, and the atmosphere, and of course dinners and the drinks were great, and that's important too. But you have to go to these congresses and meet people and exchange business cards. This old trick is still useful. There's a question here about Christina. Are we paying attention to this?
Yeah.
Okay.
Yeah, we are paying attention, but you are talking, so we decided not to. But yeah, Christina asks a question. Pablo, which translators associations
That's
are
a very
the best
good
ones
question.
in Spain?
And,
Wink, wink.
Well, I don't know them very well, but there's not. And from my point of view, they are not. There's not a medical translator association. What you have is a general, and the one called ACETRAL, which is the Spanish of Translator Association. That's a good one. But Christina, please consider joining international associations. Yeah, if you can write in English, and I've seen you can, I would really recommend that. If you want to be a member of ACETRAL or of any of the Spanish ones, it's good, of the Argentinian or wherever, it's okay. I think it's necessary, and it will help you at the beginning. But please consider international. Please think of ADA, think of ITI in Britain, think of IAPTI, which is a small association based in Argentina, but they are really doing a great job, and people there are very good, and they really are worried about our job, our profession, as from an ethical point of view and from a professional point of view, and that is very important. And I would really point out IAPTI because of that. So Christina has understood, and she says international.
Great suggestion. I love your suggestions, Pablo. I think you shared a great deal of good tips, and I completely agree with everything you said. I probably would have added that you need to have a better online presence, because we live in a digital world. We no longer live in a stone age without internet. So internet is everywhere. It's part of our lives, and I think it would make much more sense, and it would help you along the way if you establish yourself online as early on as possible. I think every translator should get a website. Maybe something basic. You don't have to have super exciting with flash effects or a video or whatever. Just something basic that tells the client who you are, what you do, and how you do it. And it's not that difficult. And I think it shows that you care, that you invest in yourself, invest in your business, and you are here for the long run. And yes, I think it would help translators in the future if they have visibility from day one, because I mean, whenever you're reaching out to a client, the first thing they're gonna do, they're gonna Google you. It's just the reality we live in. So, and you want to make sure that when they Google you, they find you, and when they find you, they're gonna like what they're gonna see. They're gonna see that you're a professional, that you have a great experience or great background in medical translation, or you have a degree, or you are a member of an association which you can say loud and clear on your website, and it's going to say that you're a professional and that you care about the profession. Probably the quality of your work going to be high.
May I add something? I would like to add something. This is something I tell always to my students. I think this is valid for any translator, but I would recommend it particularly for medical translators. What you need to do is to build your own personality as a medical translator. That means that you have to try societies, and maybe next year you listen to this and you decide to become a member of ACETRAD. I don't know. Okay, you tested them for 1 year. It's not very expensive, and you test. If you don't get what you need, if they are not giving, go ahead and try another one, try an international. To me, it's taken time till I reach IDI. I'm very happy with IDI today, and although they are very focused on English, translation into English, but I really learn every day a lot from how they talk, how they search for terms, how they do. So you have to build your personality as a medical translator. That means you have to know everything about your language, everything about the other language, the English in this case, as much as you can of the medicine in this case, and then take a decision every day with every term you find. Every document is different, every client is different, and do not pay attention to those teachers or speakers who say the way to translate this word is this one and this only one. What you need to know is a person who advises you to what to do when you face this particular term, and in the end, build your own personality. It's like, you here in Spain, when you go to a good dinner, a high society dinner, you will find one of the cutlery, you have the fork, the knife, and you will find a special one for fish, which is the fish knife, we call them, la paleta del pescado. Okay, my metaphor, my example is the following. You need to know very well that you will not use it all the time. And maybe even when you have it there, it's not necessary to use it because the atmosphere, because people is not using it, because, I don't know, because you don't have fish on the dish, wherever. So, but your obligation as a translator is to know very well what the fish knife is, how to use it without, easily, where it is, and then when you are in an actual dinner with actual people, with real people, you decide if you use it or not, if you ask for it, if you don't have it, because maybe you have to say, please, may I have a fish knife? And that's what my metaphor for building your own personality as a medical translator.
Yes. I think it applies to every translator, not only to medical.
Yeah, I love the metaphor.
Yeah.
Well,
yeah, absolutely. So we have quite a few questions from the members of our audience. Some of them were posted in advance, some of them were posted right now. And to everyone who's watching us live, we are encouraging you to post questions by clicking the orange button below this video. So I would like to ask the first question from Marcella. What are some good ways to find clients in the life sciences?
Sorry, I'm afraid I will repeat myself. First of all, what is not happening today is that that you will offer your experience or your knowledge in the market and wait for clients to come. That is not happening. I often have messages from doctors, from physicians, actual physicians, who decide that they would like to, because they consider they speak good English or whatever, they decide that, well, now that I know medicine and maybe I've translated a bit, probably clients will be wanting me. Well, I will just let them know that I am available and that's it. No, you have to look for clients, prosecute them, go after them, pursue them, and then a few of them will give you work. So the way to find clients today, from my opinion, is that have a very good curriculum, look for agencies, and stay connected and be on the net. There's no excuse for I don't like Twitter. I don't like. You are wrong if you still consider Twitter a network of gossiping. It's not. You can find, for instance, a few recently, like 2 or 3 months ago, there was a complete course on I think it was biology, on the internet, just by tweets. You know, one tweet, and you only had to be there, and they were sending very well done tweets with images. Would you have a minute or two to read? It was absolutely exciting being there, very, 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 very close. It was near. It was easy to follow, and they did that. It was on Tuesday or Wednesday, and I learned more there than 1 year at school, at the high school. Because of course I'm not very good on biology. So if you want to find clients, make yourself available. Study, you know, this job of us means studying for your whole life, and means, of course, this is always, I always say again, you have to read all the time, because you want the practical things. No, when you say, where do I get clients? You want me to give you a link to say, look here, and you will find clients. No, there are no links like that. You have to be available. You have to show you what you have, show you your cards, and show it to as many people as possible. And you can do that with a professional account on Twitter and Facebook. You can do that, and it's absolutely available. So go to congresses. That's the other place where I found, where I've met friends. I have a lot of friends who are translators, very good translators in many countries, and you get work there. You find clients through them. They have good clients, and suddenly they find a person who shows that some command of languages, and their own language is a person with an average culture, and probably good in his profession, and they will think of you, as I thought today of this colleague, they will think of you when they need a translator. So that's all I can say. There's not a one to say here. Clients, no, there's not something like that. And the only thing I can offer is be available, be connected, and be a member of associations, go to congresses, and it will happen. Believe me, it happens. When it takes time, but you will find work as a medical translator. But you need patience. But it always happens.
I think that another great way to find clients in every area, and probably in life sciences as well, is going to some events that are for the clients. So to life sciences conferences, medical conferences. I'm not sure how much it can cost, but it's something Chris Durbin talks a lot about. When you're sitting in a room full of translators, well, you're just one of the translators. When you're sitting in a room full of clients and you are a translator and ask a question and you say, hello, I'm a medical translator, that's something that's just gotta catch the attention of the potential clients. So I think it's something to consider. What do you think, Pablo?
I'm not very sure. I'm not very sure. I would say that, well, let me say something. I don't provide better medical translations than good translators who are not physicians. That's the reality. I don't. There's a cat there behind you, Elena. Hello. Yes, mine is here also. Oh,
it's everywhere.
That's a cat tool, isn't it?
Yeah.
So I don't say. Of course, I provide very good translations, but my good translations are not better than those provided by general translations with a good medical background. Mm-hmm. So being a physician is very good. It opens you a lot of doors, being as a medical translator. But I'm sorry, I'm lost. Your question was? Again.
My question was whether it's worth attending some medical conferences or events for medical professionals to connect with your potential clients there, whether it makes sense, whether it's feasible at all. I don't know, maybe they just cost a fortune going to a medical conference.
Specific conferences, you mean specific conferences?
Yeah.
Well, that's one of my plans for those of you who are listening. We need an international conference on medical translation. If you are a sponsor or whatever, just organize it, because we need that. There's not a medical, as far as I know, there is not a medical translation conference which is world to go. So what you have to look for is conferences where they have some medical part, and see if, first of very important, I insist on this, get the speaker, find a speaker, who is the speaker, and check that he or she is currently a translator, and is not one of the persons who is going from conference to conference, delivering the same story, which is valid for anything. No. Look for someone who's talking to translators, who is a translator, and probably who has a medical background. You find that, of course, on ADA. You can go to ADA in Washington in October. It's like the 26th. I'll be there. I'll be speaking there about clinical trial protocols translation. You don't need to check me out. I am a physician. I translate every day. But there's a lot of medical there. And because they can afford that, since they are a very large organization, they can afford to have a part of medical, a medical division, a Spanish division. So you need to look for large conferences, for really important ones, and there are many along the year. And I would say this for Spanish translators: do not waste your time on small ones here for 60 people, for 50 people, because I'm sorry to say that they are not useful. You will not get work there. You will not learn, as far as I know, you will not learn what you need today. You will find, as I told you, people who's jumping from one conference to the next, all through the country, and never out of the country. They were never invited to the United States of Argentina or anything anywhere else, and they insist on always the same people doing the same things. I don't think that's worth. So widen your perspective, go international. You are good in languages. You need some money, because going to ADA is expensive, really expensive. But to me, it's probably besides computers and programs, it's probably the best investment you can do. So I will mention only ADA now. I don't know of any other good ones. But I will also advise, of course, my conferences in October in Argentina, which are medical, and I will be training there a lot.
Awesome. We have another question from Sabrina, and I think it's a very interesting topic for the conversation. Do you think that market conditions are changing for medical translation in general?
Yes, the market has changed incredibly. What we did 5 or 10 years ago has changed, particularly in Spain, because we had this change in regulations in 2015 about medical translation, and things have changed a lot. So we used to wait for large works. Probably most of the time you want medical text. What do you think when you talk about medical translation? An article in a journal, right? You said, well, the discovery of CRISPR, let's say 3 or 4 pages, very technical, and with the guidelines from the journal. That's changed. We're not doing that. There's very few people doing that. What we are doing today is always related to clinical trial research, which means you have to be available, you have to be very fast, you have to know very well what you're talking about, you have to be very involved in the situation, because as you know, the world of medicine today is led by pharmaceutical industry, and they are our clients, and they are not our enemies. We have to be for them and to try to get work from them. And what they want is related to drugs, to therapies, to research, and it's 90% of the market today. So you won't find large documents. You have to be ready to have several clients. Of course, this is basic. You cannot have only one client. You have to be several clients and be ready to accept just a paragraph, just a couple of pages. That's what we are doing now. There's a lot of what I've done this morning was a very common task in my profession, which is you have a document and there's a new version of that document, and what they send you is a tag changes version, and you have to translate only the changes, which means that you have to be know very well what they are talking about in the original one. You don't have a lot of time. You have to read it really deeply and to understand what is going on, what they're talking about, just to make these few changes. And maybe there are few changes, maybe there is a lot, and they want you to translate this sentence here, this paragraph here, and maybe 2 pages at the end. That's very common today when you are in the market, and you have to be ready for that. So don't expect that they will bring you the Harrison to translate, because the Harrison was a medical textbook I wanted to show you, but I can't. Don't expect that, because that's not happening. And probably don't expect to translate medical articles. For instance, there's not a lot of that in the market. There is some, but there's not. Focus on clinical trial research. There's a lot of job there, and they are leading the market, and their needs and their opportunities are the one we're seeking, and they pay well, by the way. Most of them pay well. So that's it. That's what I would say.
Great answer. We have a comment from Marcela. She says,
Argentina.
when are you coming to Argentina specifically? She would love to.
If everything goes right, I will be in Cordoba on October 13th or 14th, in Rosario like 16th and 17th, and in Buenos Aires from the 19th on, like for 5 days, 5 or 6 days, and I will speak in all those places. Please look for Traducción Médica Aplicada, which is my Traducción Médica Aplicada, which is my Facebook wall, professional Facebook wall, which is absolutely free. I don't win anything. Where I post all my activity, but also, and this is more important, all the information you need to be updated in medical translation, congresses, articles about languages, about science. I take care to post there those articles translators can read and will be interested in reading. Now, I will not post there very scientific things, or I will provide summaries, and of course in this Facebook wall, Traducción Médica Aplicada (TMA), you will find all my activity if you're interested. But
if you probably provide the link in the show notes. If you send us the link to this Facebook wall, we include it in the show notes, so that people could find it more easily.
I'm not selling anything. It's absolutely free. It's something I do free.
I want to take the next question from our sponsor, but not because they're our sponsor, but because that's something I feel really curious about myself. It was something the reason why I couldn't translate medical texts when I tried it somewhere at the beginning of my career. Does it sometimes get hard psychologically to be reading so much about people's illnesses?
I don't get you. I'm sorry. Can you repeat your question, please?
Does it sometimes get hard psychologically to be reading so much about people's illnesses?
Well, yeah, of course, but that's human. You know, when I was studying medicine, I had many of the diseases I studied, except gynecology. You know, I did not have those, but all the others, you feel like that. And of course, you remember I told you today about this colleague who wanted a translation, and I ordered to a friend of mine, to this other colleague I've never met. Well, it was a report of someone who died after a terrible medical experience, and a terrible cancer, and you never get used. You always say, my God, all this happened to you, and you're always reading terrible stories. So, well, I don't think it's for anyone, but today we had this. In one forum, for instance, we had this question about something which was called like breathing bound, something, you know, a bound which is in your chest, breathing chest bound. There's this type of bounds, and what happens is that the inner part of the lung gets a connection to the outside part through the bound, you know, in the chest. So you are breathing normally, but your air is escaping through this bound. So you Google that, you just write bound chest, breathing, lung bound, and the first thing you find is a terrible video of a boy, a small child with a terrible bound. And my God, and you have to be ready for that. That you are not, you will not operate. You will not be in the how do you say, the surgeon's theater, the operating theater. You are not going to operate people. That's not our part. But of course, you have to psychologically prepared for this job, and it's not. Many times it's not easy when you have these reports of what is what. But at the same time, that if you are following a research, you're translating periodically for a research which is taking years. So things are going on. It's very interesting. You learn a lot about your own and your profession and humanity. You learn a lot by just how they react. For instance, while you're investigating a drug, you have to report everything which happens to the patient. That's what I do. You know, many times I have to translate what they call adverse events, and you have to translate what has happened to a particular patient. At the end of the report, you have the opinion of the physician. The physician considers that what's happened is related to the drug or not, and the physician always says yes, it is. It may be related. This a little bit further, you have the company's opinion. Do the company consider that there is a relation between what's happened and the drug? The company will say no, there's no relationship in there. And you're always seeing that, and you say, my God, so this is our world. That's what's happening. The company doesn't want to be responsible for the adverse event, and the physician wants them to be. So yes, you have to be psychologically prepared.
I guess it all comes with experience. The more you work in this field, the more you translate those kinds of texts, the easier it gets, right?
Sorry, I didn't get you. Can you repeat that?
I guess it all comes with experience. The more you work in this field, the easier it gets, right?
Do you mean if with my experience it's easier?
Yeah, the more experience you have, the easier it gets.
Yeah, absolutely. But that wouldn't prevent anyone from trying. Of course, you need a lot of experience. For instance, if you are on this following, as I said, a clinical research, or you're so lucky that you start with a drug that you're trying and that you start at the beginning. Many years ago, let me say another example. Many years ago, I started translating about a new drug which was for how do you call this, androgenic alopecia, you know, which is men losing their hair, which is so, you know, we are not investigating enough about cancer or about really malaria, but there's a lot of efforts because if you find something which will help men not to lose their hair, you will really have a market there. So, and that was for years. I followed that for years. Probably 6 or 7 years, translating periodically about androgenic alopecia. 4 or 5 months after the beginning, I was absolutely sure the drug was going anywhere. They couldn't get anything. That wasn't helpful. It wasn't helping people, and I knew it. I was a translator only with some experience as a doctor, as a translator, and I knew it. But I kept on translating. They never asked your opinion, that they won't. But I knew. I was absolutely sure, and definitely today there's no drug for androgenic alopecia. So experiences absolutely. The more experience, the more clients you will find, but you need to start somehow. And believe me, I want to be very positive on this. There is an opportunity for all of you who want to translate medical. There's opportunity. If you are a good translator, if you know how to do it, if you learn your language, you are the best on your language, you are the best on English, and you are the best on medical, you will find work.
Yeah. Absolutely.
Our next question is from Janina. She's asking, what do you think a translator needs to provide good quality translation of regulatory related documents? Do requirements vary from one country to another? Are there reliable sources of info about this area?
Yes, of course, regulation changes. It depends. If you're translating in Europe, if you're in Europe now, today, it's very easy to be updated with how do you say, regulations with the regularity authorities. It's very easy to keep updated. We have in Europe, we have the EMA, which is the European Medical Agency, with a wonderful website. It's everything is wonderful about the EMA. I have to say it. It's very easy, and the legislation is so clear, and you have to. And it's very easy to know. But on the other hand, it's very restrictive. If you are translating official documents and what we call the summary of product characteristics, which is what we call in Spanish a ficha técnica, or resumen de las características del producto, which is the official document where you find all the information about a specific drug. And translating that, it's not only that you have to consider to pay attention to administration. It's only that the EMA have templates with every word you can use and every sentence you can use and you cannot. And a minimum change and a minimum shift from that will be a mistake, a problem, and they will never call you again. So that happens in the EMA in Europe. If you translate in the States, things are different. They are the legislation is wider. It's not as strict as it is here, although that's changing also. And you have to be always very well updated about ethical considerations. Remember that one part of our job as medical translators, a very important part, is translating for patients. And it's completely different, and you have to be very good on that. When you are translating for patients and your readers are patients, you have to change completely the register and be very attentive. And there is a lot of regulation, of administrative regulation of what you say to patients and how to do it. For instance, something as easy as a label, the label inside a drug, you open this prospect, this label, and you see there, what is this drug, how can I use it? That is word by word, at least in the European area, word by word, in a template. And if you don't know that, if you don't have experience, you will, okay, this is a very easy translation. What is, I don't know, acetaminophen? We don't have acetaminophen. We call it paracetamol in Spanish. But what is acetaminophen? It explains for patients how to use it, how to keep it, keep it away from children. All these instructions. You need to know exactly what the European Union wants, because it's word by word, sentence by sentence, predetermined on a template. You will find easily on the EMA website, and you can get a translation memory. It's very easy to get translation memories from the European agency. And always, when translating medicine, you have to have an eye on regulation on that issue. Of course, that transferring data, personal data from sick persons, it's a very delicate matter, sensitive matter. You have to be very careful about that.
Great answer. Another question from Tanner. Is there a way to do medical interpretation without taking classes and certification, or are they required? How much does it differ based on the state in the United States, if you know?
I'm sorry, but this question is probably from an interpreter, right? And I don't know very much about interpreters. I'm sorry. There are people who knows more than that, and I am aware that that you need specific authorization from every state in the United States for being an interpreter. By the way, although I don't know a word about this issue, I'm sorry, you should invite Tony Rosado, which is probably the most important authority and he's a very good friend of mine. And we were together in Mexico last April, and we had a great time together. And he gave a wonderful conference about medical interpreting. So try him, Tony Rosado. He is very active on the nets, by the way. But what he told me is that it's really difficult. It's not easy. You have to get the specific authorization in each state. But do not translators, do not forget that we are also prepared to be interpreters. You can also specialize in that, and there's a high demand of good medical interpreters, because there are conferences all over the world and they need interpreters. So don't disregard this possibility. It's also a possibility for us. I did it at the beginning of my career. Today I'm getting deaf, so I'm not. I cannot do that. But no, it's true. I'm getting deaf. But when I hear normally, more or less normally, I did that, and it's wonderful. Try that. It's a possibility for us translators if you can do that, and you learn a lot. It's a wonderful profession. If you talk to interpreters, medical interpreters, they are all in love with their job. They really love what they do. They are very passionate, as I am with this. They are also very passionate, and it's always. I think the reason is because it's wonderful, and you need to consider that.
I think a lot of translators and interpreters are passionate about the area of specialization. It's just the nature of our job. It's not that easy. So if you are not passionate, you probably wouldn't stay here for long.
Yes. But it's extremely difficult, I have to say, extremely difficult, but very challenging. And you see people here who are taking courses with me shortly, and Lucia, Susana, Gonzalo, so we'll meet in September. We do this practicum, so I will let you know. It's sold out right now, so I'm not selling anything again. But we do this practicum, which consists of just people translating medical, and I personally correct for them. And we meet on a platform, and we talk about their translation. I will tell them what's happened. If they've paid attention to our conversation, they've got some clues about what they will find in this practicum. And I also saw, if you allow me, I also saw someone ask for my best experience or my worst experience as a medical translator. I will tell you that we had this practicum, this kind of course I'm talking about. The first one, it was in January. And you know that my students are usually women. It's 90 or 95% of my students. There was only one guy. This guy was the best translator I've ever met. And he was there from his country. You know, he got up like at 5 or 6 in the morning to talk to me, and he was there. And that was, I won't talk about my worst experience, but my best was that. Finding that someone who had not been to my courses, I didn't know of anything, very young, and in a Spanish-speaking country, South America, he was the best translator I've ever met. He knew everything. Of course, he was working for an American client in a very good company. He was studying in Canada, by the way, and I have to say that he flew to Mexico to meet me when I was there in April. That was very good, and it's a great experience.
Awesome. So it's lovely to hear stories like that.
Beg your pardon?
I said it's lovely to hear stories like that.
Yeah, that's very good.
Inspiring examples.
Yeah, yes.
Speaking about education and continued education, Nicholas asks, can you recommend a postgraduate program for medical translation?
No, I don't know. I'm sorry. What I've told about me, and I don't know a good one. There are, of course, there's a myriad if you go into the internet. So the only thing I can advise, again, is that you have to look for the good teachers. You read the program, you go in the internet, look for medical education for translators, and you will find a lot of possibilities, a lot. And online, presential, with being there. There's a lot of possibilities. What do you have to do? Of course, see if the program, if what they offer is good for you. That's elemental. That you don't need to be here to me to tell you. But then go to the teacher. If you don't find the speaker, bad. You are not interested. They say, we have this wonderful course with this program and that. Where are the speakers? Who is teaching me? It's not there. Don't go ahead. You don't need that course. Go there and find the teacher. Do they have their You can find his curriculum or her curriculum and his experience. Analyze that, research on that. Look for him or her on the networks. Look what he's published as a medical translator. I've published a lot of things, but my own, and I'm not a writer. But you feel like you have a blog, maybe you have a blog or something. Look for the teacher. Get interested, get in contact before. Say, try to follow him or her on the nets and see if you can, what you can learn from that person. And then that's your course. That's where you can get good medical education after a research. I won't say names, but it's very easy to make a difference between the good ones and the bad ones. And you need a person who's very good in English, very good in Spanish, who has a strong medical background, who has experience as a teacher, and who is currently translating. It's very important. If they are not translating today, they will not be good teachers for today's needs in the medical translation market.
Mm-hmm. We have a question concerning a particular master's degree. So Maria is asking, Pablo, what's your opinion about the, I'm not sure I will read it correctly because it's in Spanish, Máster Universitario en Traducción Médico-Sanitaria of, and here comes the hard part, Universitat
Jaume I. Jaume I. Very good, very good.
My mom learned Spanish, so that's why I can read it. I'm from Argentina and I've been considering taking it.
I see. Yes, there is, in Spain, there are 2 masters for they say biomedical translation. And one is this one you've mentioned by a university in Castellón de la Plana, which is on the Mediterranean coast. And it's called the Jaume I, which is James I, an old king of the area. And what they say about that, I know some of the teachers, right? And they have teachers who are not translators. Is that enough?
Mm-hmm.
They have to. So what I've learned from students is, first, it's not expensive for American or for other countries. They found it inexpensive, which is useful. That's a good thing to say. Second, it's very really demanding. You need a lot of time. You have to. You are not just working and then at the end of the day I will dedicate a few minutes to see how the master is going. No, you will need to work every day 3 or 4 hours, and to get deep into language and the theory of translation and all those things that, in my opinion, you already know if you have a degree in translation. On the other hand, some of the teachers, a few of the teachers in this master are the best in the world. And I really mean that. They are the best translators in the world. And they are teaching for 2 weeks, for 1 week. So please pay attention to my words. Go to the Jaume I, look for the teachers, analyze what they are teaching, who they are professionally, if they are in the world of translation. Because if they are only teaching there because we don't know how got there and nothing else, maybe you will change your mind about the master. There is another master in Barcelona called the Pompeu Fabra University. And I think they had problems last year recruiting people because it's a little bit expensive for the Spanish terms, but it's still inexpensive for American terms or for Belgian terms or for Canadian terms. I don't know their teachers, but my advice is still the same. Go there, see the programs, and research about the teachers. And if they meet the requirements I've quoted many times today, go ahead.
We have another question in the chat that was answered by one of our participants, but still, Pablo, are your courses in English or only in Spanish?
I do both, fortunately for you. As a matter of fact, I think that my first question when I go to ADA in October, they gave me the possibility. They say language of your presentation, and they say Spanish /English. So my first questions will say, please raise your hand, those of you who want me to speak English, and raise your hand, because I'm not really sure. I have courses in English and in Spanish. I am better than in Spanish. Marie Claire, thank you. I am better in Spanish than in English, but I have both. Thank you for asking, Roberta.
Somewhere along the way during our conversation, you mentioned that having a good curriculum is one of the major requirements if you really want to get more work in this field. That's why Carlos asked questions. What would you say constitutes a good curriculum?
A good what?
Curriculum.
I don't get you. I'm sorry.
A good resume.
A good what?
A good resume.
I don't. It seems I'm getting tired. Can you write it? Maybe.
The last question in our question box. Yeah.
Curriculum. Oh my God. Thank you, Lygia. Thank you, Marie Claire. I'm sorry. You know, I was not lying when I said I'm becoming deaf. So, I'm getting deaf. So the question is some advice on curriculums, right?
What makes a good curriculum?
Good. First of all, make yourself different. Of course. That's very important. All the information on the very first impression for the client. You have to be there. Your pair of languages. Your specialization. When I'm reading a curriculum, I want to have all this information in of my first impression. I'm looking for that with my eyes. Even though you have images or tables or wherever, my eyes are only looking for your name, your nationality, your age, probably. I don't mind about your sex, and but you will be a woman probably, and your specialization and your pair of languages. That has to be absolutely clear. Then there's another thing very important in curriculums. I will never use a curriculum which has a single typo. Typos are not this terrible thing. People saying, "Oh my God, I've seen you saw that. There was a typo in that." That's something which happens. Typos happen, and you have to get used to that, and you have to lead with that. But not in your curriculum. You need to have your curriculum read by a lot of friends, like a lot of colleagues, and be sure that there is not at all a single typo, because that won't pass any test. Nobody won't go on reading. And it seems very elementary, but it happens all the time. Last week, I have an invitation by one of the most important Spanish associations of, say, professionals. I won't specify, but linguist professionals in Spain. And the vice president was writing to me very formally. They were inviting me to some event, and at the beginning there was vice presidents, and there was a terrible typo there. You know, there was a letter missing, and oh my God, I'm dealing with these people. They're writing to me, and they're inviting me as a professional translators. And of course, the message was wonderful. There was explicitly well written, and but the subject of the message, there was a typo there. So no typos in your curriculum. Make sure that all the information relevant on your pair of languages, your specialization. If you have not a specialization, imagine one. What would you like to translate? And try to deepen into that. And maybe if someone gets interested because you said you are good on immunology, you will have time to get ready. And of course, many courses to do it. But the first thing I want to see is your name, your age, your nationality, your pair of languages, your specialization, and you need to be specialized. Don't say I translate. Please don't say I translate law and medical and technical. I will not accept. I will not go on reading myself. Maybe others do, but I won't do that. So if you're trying to get a job as a medical translator, make very clear that you are specialized on that, or you want to do that, and you are not doing anything else, any other specialization. That's a bit of what I can say. Learn more about that in Cordoba next October, Cordoba, Argentina. I will be speaking about professional orientation for 3 hours, and please join me.
Yeah, I think it's important to really pinpoint your specializations, and you can have different CVs for different purposes, which is a great way for people who specialize in who have several specializations. So you can be, well, I couldn't be a legal and a medical translator at the same time, because that's just, I think it would be just too much, but probably someone can do that, but you just don't have to tell people you want to give you medical translations that you also do legal. That's just, yeah, you can just show them that you're serious about your medical specialization.
So one day I get a medical translation from you, done by you.
I don't think so. As I mentioned, that's something that I tried, and it's just, well, I'm not made for doing medical translations. I think I just take everything too close to heart. So, yeah.
What about you, Dimitri? Do you do medical translation?
Occasionally. Actually, I love medical translation because of the terminology involved, the language structure. It really fascinates me as a linguist. But I don't dive deep into something very highly specific like genetics or something that I need to do an extensive research. So something very basic, general, like a doctor's note or something like a certificate from the doctor or something like that. I can do it. I can do it with proper research, with proper time. But translating an article for medical journal aimed at medical specialists, that's probably something I would rather refer to a colleague than take myself, because you gotta know your limits, right?
Yeah, I cannot do audiovisual, for instance. I will not dare. Well, if I'm angry, I will, but not today. Not today.
Probably one of the last questions. Marcela asks, as an agency, how do you find direct clients? It's probably not quite the topic that we were discussing here, but maybe you can give some tips on finding direct clients.
Working with direct
what has worked for you?
Working with our clients is wonderful, of course, but it's a very good opportunity if you have it. They pay more. They give you more interesting jobs. They provide you with many good things, but I insist on the protection provided by agencies, and I really like that. There's a lot of people who thinks, as I told you, that agencies are our enemies. They are not. And if you have a direct client, I think I only have one direct client in the United States, and of course they are great. The fee they pay is the top. I have never have this fee paid, never in my life. Only with the WHO, when the WHO, the World Health Organization, they pay similar fees. It is the top I found in the market. So of course, working for direct clients, but the responsibility is huge. And if you don't have a background, I guess that the responsibility is too much for you. And the only way to make it easier to not to have such a responsibility is to have an agency in the meantime, or a medical reviewer who can check what you have translated and approve it from a medical point of view. So if you have direct clients, congratulations, but it's not easy. There are not many, and it's a huge responsibility. Be ready for that.
Yeah, absolutely. Well, pretty much like in any other industry, in any other field of expertise, direct clients are always a huge responsibility, and you have to be ready for that.
I'm sorry, I wasn't. Can you repeat that?
It's okay, Bob. I just mentioned that, like in any other industry, direct clients are always a great responsibility, and the risks are higher when you work with direct clients, and you have to be ready for that.
Please. Maybe I haven't explained myself well. I'm not saying that working for agencies takes the responsibility away from you. Yeah. It does not. Of course, you have a lot of responsibility. But with direct clients, you don't have discussion to protect you and this defense that they give you. But I agree. I'm sorry for.
So thank you so much for joining us today, Pablo. We've been talking for, I think, almost an hour and a half. And you've answered pretty much all the questions that have been asked by our members of our audience. And I'm really grateful to everyone who has posted questions. We have one last question, and I think it was meant as a joke. I hope so. What kind of medication do you recommend?
Well, I have an advice for that. I have a good one.
Because you work in a pharmaceutical field, you probably know a lot of drugs.
Well, let me say that drugs are, again, our friends. I mean, pharmaceutical drugs. I mean, that's from pharma, and they are good drugs. If you have problems with anxiety, and we do have problems with anxiety, and you have problems for sleeping, and we all have problems for sleeping, you can find help with drugs, of course, with your doctor. Your doctor can prescribe you a good drug, the one you need. And you know, I don't sleep well. When I was a baby, my mother complained about this child is never sleeping, and I had really big problems for sleeping. So when I was 18, I went to a psychiatrist and I said, you know, I'm not sleeping currently. What can I do? And he said, well, I passed all the tests, and at the end he said, your psychiatric status is acceptable, let's say, it's acceptable, but you don't sleep. It's like you don't have a lot of hair, you have blue eyes, it's a personal characteristics, you don't sleep. And he prescribed me a drug I've been using for 40 years. And I have the warranty every day of my life that I will sleep well and I will be fresh every morning. And when you travel, when you work, having the warranty of sleeping, regardless of the considerations, of course. So investigate. Why not? If you're in the medical translation world, why don't you research about the drugs you can use to help your profession? There are a few ones, and always ask your doctor before, of course. Never self-prescribe. Never.
Well, that was a great talk. Thank you, Pablo, for joining us. It's been a pleasure talking to you. And well, as we see in the chat, everyone found it useful. And thank you guys for your kind words. It really warms my heart. And that's basically why we're doing it, right, Dmitry? Because it's great to provide something useful with the help of our dear guests, of course. Thank you, everyone, for joining us tonight or today, depending on where you are in the world. Please don't forget to check the website of our sponsors at smartcat.ai. And don't forget to share the link to the recording of this webinar with your friends and colleagues. You can just share the link to this page. The recording will be here, or if you're on our mailing list, you'll get a link to the recording when Dmitry uploads it to YouTube. If you're not on our mailing list, you can subscribe to it at translatorsOnAir.com, and we'll see you next week.
Mm-hmm.
Thank you, everyone.
Yeah, thank you so much for joining us.
Thank you. Thank you very much.
Bye.
Bye-bye.
Bye-bye.